Prepare, don't panic. That's the goal of our partnership with Texas Children's Hospital this week. We want to make sure you stay informed and safe. And today we're chatting emergency care and children. Joining us now by Zoom, Dr. Brent Kasny, Medical Director of Emergency Management at Texas Children's Hospital. Welcome to the show, Doctor. We appreciate your time. A lot of parents out there may be wondering if their child starts showing signs or what they think are signs of COVID-19. Is the ER the right place to take that child?
Sure, Derek, thank you for having me first. And I just say this is a very interesting and difficult question, I think, for a lot of parents that they're struggling with. And I think this happens even when we're not in the midst of this pandemic that we're dealing with right now. Parents are at home with their child's developing fever, cough, congestion, these symptoms that are very similar with any kind of flu-like illness, and they're not sure exactly what to do or where to go. I think first off is really recognizing what seems to be manageable at home. If you give fever medicine, give medicine to make your child feel better, like Tylenol and ibuprofen, and they seem to improve, then you're probably okay staying at home and not going to the emergency center, which is really designed for emergencies and emergency care. What we'd like to do is keep people at home, keep them safe, but obviously know that we're here for them if needed. We've really expanded some things at Texas Children's to try to improve our ability to have patients access us, like things like telemedicine and telehealth visits. I think these are other avenues that parents can take to talk to their regular pediatrician, potentially visit one of our urgent care sites, but trying to keep the emergency center for really true medical emergencies.
And people want to have the peace of mind that in case they do need medical care, that you guys are prepared to handle an influx of folks who may be infected with COVID-19. And based on our conversations that I've been having with other doctors this week from Texas Children's, it seems like you guys are prepared should an influx happen.
Yeah, I mean, when you look historically at Texas Children's and some of the preparedness initiatives that we've done in the past, we've shown that we have some things in place to deal with this type of a surge of patients that we might expect during this COVID-19 pandemic. One of the things that we did during H1N1 in 2009 was establish our mobile pediatric emergency response team, which is essentially a pop-off valve for our emergency center to deal with a huge influx of patients. So overnight, really when H1N1 kind of hit the scene in 2009, we saw our volumes rise from around 200 patients a day coming to the emergency center to about 366. So a huge jump in patients presenting. What we've done is establish an alternative care site for those children that are presenting with viral URI symptoms, fever, cough, congestion, where we can see them, provide the same care we would be providing in the emergency center, but offload that burden on the emergency center, potentially to see 100 patients a day through that site. Again, I think the added bonus of this is we're also kind of protecting our vulnerable population that we take care of at Texas Children's. So we have a number of oncology patients and other patients, transplant patients, that are immunocompromised, that this disease may impact more greatly than those healthy children out in the community that we also care for.
And when it comes to those healthy children out in the community, let's talk about how families can just keep their children safe at home. Because, Dr. Kasny, right now, a lot of counties in the Houston area, they are under the stay-at-home order. Parents might be thinking, okay, is my home sufficiently stocked with medications and things that will help keep my family healthy? What should families do, and how can they prepare at home to stay as healthy as possible?
Yeah, I mean, I think really simply, to kind of put it simply, this is something that hopefully families are doing every year as we approach hurricane season. They're kind of stocking up on some supplies, things that they might need in case they have to stay at home for a short period of time. This obviously is a little bit different because we're looking at a much longer duration of time that we're expecting people to stay home. And I think stressing the message of following the advice of our local government, our public health authorities in this city and region are really important. And these stay-at-home initiatives have been proven across the country to help reduce the spread of this disease process. I think making sure that you have medications at home like Tylenol and ibuprofen for fever, Benadryl, other things that you might possibly use to maintain and take care of your child at home is important, along with any prescription medications that they might need. So making sure you're stocked up on those things, again, with the additional essentials that you might need in your home. But that's really where it starts. And then I think reaching out to your general provider, your primary care provider, your pediatrician, and seeing what potential remote visit access they might have as I mentioned at Texas Children's, we really expanded our ability to provide those services and seeing how best to go about doing that should you find yourself in a semi-urgent situation where you do want to rely on a healthcare provider to weigh in on your child's health.
And Dr. Kasny, we're over time now, but quick question from a viewer. Is it safe to order food and have it delivered to our homes? Because I know there's been a lot of questions about how long the virus can live on surfaces.
It's a great question. I think there's still a lot that we're learning about this virus. And my wife actually asked me this question the other day. I think if you take precautions, so again, get the food, take it out of its packaging and put it into a bowl or a plate that you have at home, dispose of the packaging and wash your hands afterwards, you should be safe. We don't have any indication that the food itself is transmitting this disease process. So again, it's about good hand washing and those other things that we're preaching endlessly, through this pandemic.
All right, Dr. Brent Kasny, thank you so much for your time. Thanks for helping to keep us safe. And a reminder that Texas Children's Hospital will be with us all week long to answer your questions. So please visit our Facebook page to submit yours. And for more information on Texas Children's Hospital, you can go online to texaschildrenscoronavirus.org. We'll be right back.